Evening, everyone. Thanks for joining us tonight. As I know there's still several participants joining us, we'll just go through just a couple of intro slides before we go into the evening. So welcome to COVID Conversations. All lines are automatically muted during the program. There is a question and answer box at the bottom of your screen. Please use that to ask a question. Or to leave a comment, and we will try to go through questions as they come. And next slide, please. This is put together by the California Immunization Coalition, which is a nonprofit public-private partnership dedicated to achieving and maintaining full immunization protection for all Californians to promote health and prevent serious illness, disability, and death. And the American Academy of Pediatrics, all of the local California chapters. The AAP California is committed to attainment of optimal physical, mental, and social health and well-being for all infants, children, and adolescents and young adults living in California. So I am Pia Pannaraj from Children's Hospital, Los Angeles, and my co-moderator tonight is Dr. Jasjit Singh from Children's Hospital, Orange County. And she will be introducing our wonderful guest tonight, Dr. Burke Harris.
Thank you, Pia. I am so happy to introduce Dr. Nadine Burke Harris today and welcome her and all of you to our California Immunization Coalition AAP COVID Conversation. Dr. Burke Harris began her pediatric career as a researcher and an advocate for those in vulnerable communities. With time, she has developed a vision to find the roots of disease in childhood adversity and treating its long-term consequences. I think we were all really excited when she was appointed as California's first ever Surgeon General in January of 2019 by Governor Newsom. And she has subsequently become a trusted voice in the state's COVID-19 pandemic response. She has won many awards and accolades for her work, some of which are listed here, and we are really appreciative of her taking the time to be with us this evening. Thank you so much. So to kick us off, Dr. Burke Harris, I'd love to ask you, when you were first appointed as Surgeon General for the state, no one, of course, expected a pandemic. We're curious about what it is like in the day-to-day world of a Surgeon General, what your role is, and how it changed with the pandemic. So we'll start there to kick us off.
That's a great question. Thank you so much. And thank you for having this conversation and for inviting me. I will say that's a question I get all the time. What is the role of the state Surgeon General? Because there are only a few states that have Surgeons General. Michigan was the first one. And California has really the model of the role is very similar to the US Surgeon General in the sense that I am an advisor to the governor. I am a public health spokesperson. And really one of the exciting things about being state Surgeon General is that I've had the opportunity to really take a deep dive into some issues of public health importance. As you mentioned, some of my areas of focus have been early childhood, health equity, and adverse childhood experiences and toxic stress. Those have been big areas of focus. And as you mentioned, when the governor first conceived of the role of state Surgeon General and reached out to me, neither one of us had any idea that we would be experiencing a once in 100 years global pandemic. So it's been busy, but really my work is to work not only within Health and Human Services, but across the administration to really advance public health priorities for the governor.
Thank you.
Wonderful. Well, thank you so much for being our very first Surgeon General, especially during this very important time. some of the folks that have registered are really curious about the current status of COVID and COVID vaccines. Can you give us just a short update about COVID and then also about the booster vaccinations? That's the latest change in the vaccines.
Yeah, so I have to say, in terms of an update on COVID, I know that all of you have been working so hard. Our entire healthcare workforce has really just been heroic in response to the COVID pandemic. We in state service have also been working around the clock. It's been an extraordinary effort. And that's something that I have to say that together, what we have accomplished is that California is really leading the nation in terms of our case rates. I think I have the latest in front of me. Our 7-day test positivity rate is 2.6%. Our most recent data is showing that our case rates are continuing to decline, although still very heavily in the unvaccinated population. We see our R effective is continuing to decline and is roughly around 0.6. I have to look at the latest data from this morning, but it just really our effective has come way down, so way below 1, that we're really happy about. And part of the reason for that is because California has had such a robust vaccine program. So to date, we've administered 49.3 million doses, and that is 28.3 million individuals who are fully vaccinated in California, with another 2.7 million who are partially vaccinated. And that is really a result of the hard work of all of you and just, our local health jurisdictions and really everyone pitching in to ensure that California leads the way. The exciting news that I think that a lot of folks have been hearing about recently is that Pfizer has submitted their initial data from their trials for children aged 5 to 11 years old to the FDA. So that was submitted on just 2 days ago. And we anticipate that an application for emergency use authorization for use of the vaccine in that 5 to 11 age group will follow very soon. And it's not even a moment too early, because what we see is that the child COVID cases are on the rise. And, particularly as we want to keep our kids safe as they are doing in-person learning, what we're seeing, just the most recent data from the AAP, the child COVID cases have increased nationally around 240% since July. So we definitely have a lot of work to do. The other, important news that folks are hearing a lot about and wondering about is around boosters. So I think many of you may have heard that, boosters, the CDC has come out with their recommendation, and California Department of Public Health is following in that guidance, right, that those over 65 or 65 and over should receive, who have received the Pfizer vaccine, it's been a long day, should receive a booster, and those 50 to 64 with underlying medical conditions should receive a booster. Now, other populations may consider receiving a booster dose of the Pfizer vaccine, and that includes folks who are 18 to 49 with underlying medical conditions, or those who are at 18 to 64 who are increased risk of exposure to COVID due to their occupation or institutional setting, like healthcare providers, educators, food and ag workers, manufacturing workers, corrections workers, US postal workers, public transit, grocery store. And so that is, that's the latest information. Those boosters are recommended 6 months after completion of the primary series.
Thank you. I think since we're all pediatricians, we're very eagerly anticipating those younger children being able to get vaccinated. So thank you. One of the other things I think that this whole pandemic has opened up for us is a national dialogue about vaccine hesitancy and mandates. How do you think that this is going to affect COVID vaccine moving forward? How do you think it's going to affect our upcoming influenza season? And what are the state's plans that you can share with us to encourage widespread vaccination for both COVID and influenza?
Yeah, that's a great question. So the California Department of Public Health just put forward their vaccination strategy plan. And that's available at the CDPH website. The Vaccine Action Plan is available, just, in case anyone is super excited to dive in and see California's Vaccine Action Plan. And it really lays out some of these big questions and our approach to answering some of these big questions, issues of equity, issues of strategy, how we're partnering with local health jurisdictions, how we're partnering with the federal government, et cetera. What I will say is that when it comes to COVID and the flu, right, what we know is that last year we were prepared for a really serious flu season on top of COVID that didn't quite materialize as much as we were concerned about, which I think is, I'll take it. But I think that what we realize now, and I think that's really important considering what we saw last winter in terms of the overwhelm of our healthcare system, the filling of hospitals, the filling of ICU beds, et cetera. I think given that, and given that especially now with our vaccination rates, which are really wonderful, but what we see is kind of an opening back up of society and an opening back up of some of our mingling and interaction, that we know that as it gets colder and people go indoors, that we're going to see an even greater risk of flu. And given that we want to take all precautions necessary to communicate the importance of being vaccinated against flu and against COVID-19. Now, I will tell you that, and I'm sure that everyone here has witnessed that this pandemic has really lifted up, I think, a unique conversation that's not just about the benefits of vaccination or the concerns of vaccination. There really has been a campaign of misinformation about COVID-19 vaccines, right? And there has been a lot of fear and false information, a lot of polarization. And I think that on top of the hard work that we all have to do on a regular basis to promote vaccination and for the prevention of vaccine preventable illness, I think in addition with COVID-19, we have extra work to do in terms of combating the misinformation. And so that's a whole nother, scope of work. And I, what we see and what we hear from providers is that sometimes that means that there are, extra long visits to take the time to go through and answer all of patients' questions and make sure that they feel comfortable and in a way that is not as common. Like we all have to deal with, sometimes patients have hesitancy, but we see is the proportion of patients, right? And the level of misinformation is so much greater with COVID-19 that there's a lot of work that we have to do. And so that's the work that my office has been doing, that California Department of Public Health and the CDC has been doing in terms of providing resources. And in fact, the US Surgeon General actually put out an advisory about COVID misinformation and health misinformation related to COVID. And so, we're working on all fronts to be able to combat some of those challenges.
I have a question for you about equity, especially with respect to vaccination. So vaccination rates for people living in zip codes with the lowest HPI or Healthy Places Index greatly lag the rates of those living in the highest quartile. So it's about 58% fully vaccinated in the lowest quartile compared to about 80% in the highest quartile. So can you discuss some of the factors that might be leading to this discrepancy, and how has vaccine hesitancy that you just discussed contributed to the discrepancy?
Oh my goodness, yes. So addressing vaccine equity has been a huge priority for the state of California, and for me in my office, for our colleagues at the California Department of Public Health, our partners at the DHCS, the Department of Healthcare Services, and literally just across the administration. And some of the factors that contribute to some of the health disparities that we're seeing are, unfortunately, there's trying to combat health equity is a little bit like whack-a-mole. Like there are so many different pieces to it, and we have to launch so many different strategies, right? So for example, one challenge that we see is making sure that people have vaccine information and resources in language, right? So that they can have their questions answered, and if they have any concerns, we can do that in language. Another thing that we see is that what part of the reason why we used the Healthy Places Index to create the vaccine equity metric, right? And California was the first state in the nation to do that, is because the Healthy Places Index assesses many of the things that communities need to be able to keep themselves safe, right? Safe and healthy. So access to transportation. So we see that as we, as folks are in the most disadvantaged Healthy Places Index quartile, that means that there's greater limitations on access to transportation. There are fewer healthcare access resources within the community. There are other types of obstacles like, fewer. One of the things that we actually looked at, this was amazing. We actually geo-mapped the access to services, and we found that not only were there more healthcare services, pharmacies, all of those things in the higher HPI quartile, but their hours were more flexible. They had more weekend and evening hours in the highest HPI quartile than in the lowest HPI quartile. All of these things affect accessibility for someone who is working, has kids, trying to figure out a way to, and has other challenges and priorities, and is trying to find a convenient way to get vaccinated, right? And so that's why our response was to partner with community-based organizations, right? That addressed issues of accessibility. So we saw community-based organizations doing health fairs, being out in front of grocery stores, right? Making sure that we were making vaccinations accessible. We partnered with different vaccination providers to bring vaccination resources into our vulnerable communities, all of those pieces. But we also recognize that trust is a big issue, right? We just talked about vaccine misinformation, and particularly, for example, in communities of color, right? And so that was another reason for our strategy of partnering with trusted messengers and community-based organizations, was to recognize that many of the folks who have been working with our vulnerable communities, who have established relationships and who are trusted community partners, one of the things that we have to do is figure out how to support them in being in engaging with our communities to make sure that we get to equitable vaccination rates. But I mean, even for example, you know, when I was in clinical practice, I was working in a very underserved neighborhood in San Francisco called Bayview Hunters Point. And I was working in a community where there was only one pediatrician for 10,000 children in the population. And one of the things that we see is that oftentimes smaller practices that serve our most vulnerable communities, they actually don't have the capacity to receive the numbers of vaccines, right? Just how many vaccines come in an order, right? Like that was an issue that we had to figure out, was how to help some of these smaller practices. And so we have, one of the things that the state has done is actually work with our VFC, our Vaccines for Children initiative, that where we know our VFC providers are already serving some of our most vulnerable communities and supporting them with resources and tools and access to smaller batches of vaccines so that they can serve some of our most underserved communities. So we actually have a team that specializes in equity-focused outreach, and they look and analyze all the data and they pull apart all of this stuff and really help to try to bring the state towards our goal, because we have set a goal of 75% vaccination rate for all of our demographic groups. And we will continue working until we get there. So it may take longer, it may be more challenging, it may require more resources, and we're doing grants, and we're doing education, we're doing all of these, providing all of these resources to be able to make sure that we're meeting our equity targets.
It is such a complex issue, and you've done an amazing amount of work in this area. And since this is one of your areas of expertise, I do want to just delve a little bit further into it. When we talk about equity, do you think that some of these lessons that we've learned in the pandemic about healthcare equity during COVID, do you think that we're going to be able to extrapolate them further to the broader healthcare environment, or even our children's lives in general?
I think that is an absolutely wonderful question. So here's what we know, right? COVID-19 is a virus, SARS-CoV-2, right? SARS-CoV-2 is a virus. And it has spread across the globe. And when we look at the impact in the United States and in California, right, what we see is that this virus impacts our communities differently. And part of the reason that it impacts our communities, our different communities differently, is we start to recognize some of these structural determinants of health, right? So if you are a bus driver or you're a grocery store worker, you're more likely to be exposed and to come into contact with people in such a way that you may contract the virus. And because of our history of de facto and de jure segregation in the United States, certain groups are more likely to be in that role of bus driver or grocery store worker, as opposed to tech worker who can work from home, right? And so these are the ways that we see the interplay of historic and current structural and social conditions on health, right? We look at things like past policies like redlining that create crowded density of housing in certain areas. And then we see the higher the density of housing, the greater the risk of spread of COVID-19. So these are the ways that some of these structural factors directly impact our health. But what I think that COVID-19 has done is shown a bright light on some of these structural factors and some of these inequities and how they impact health. Because the pattern that we see for morbidity and mortality of COVID-19 is very similar to the pattern that we see for morbidity and mortality for other health conditions, right? And so what it gives us the opportunity to do, number one, is to learn from this experience and take some of the strategies around the importance of trust in the healthcare experience, right? That's something that we're all learning, the importance of trust and the importance of historical factors in impacting that trust. Now, that's important whether you're giving a COVID vaccine or whether you're treating heart disease or whether you're giving prenatal care, right? That's important, and that impacts patient outcomes. And so these are some of the things that we can learn. We can learn about how to partner, or we are learning right now, how to partner more effectively with community-based organizations and other entities that serve our vulnerable communities. And also, frankly, how to partner more effectively with our local health jurisdictions, right? And how to partner with more effectively across the board, right? With our private healthcare entities and our public healthcare entities, how we truly embrace a single standard of healthcare for all Californians. That's some of the hard work that we're doing right now.
Speaking of vulnerable populations, we have a question from the audience about how is California working to cover those in jail and prison systems for COVID. There are increased risks for themselves as well as spreaders within the prisons or jails to staff and other prisoners, and also when they leave the system.
Yeah, so we've done a lot of work on that, and I'll tell you that some of that we have learned by having some really challenging situations. And so the Department of Public Health works very, very closely with our department, CDCR, our Department of Corrections and Rehabilitation, to roll out COVID testing, PPE, vaccinations among our populations. And I literally asked this question yesterday morning in a kind of a cross-government coordinating call. And we are actually rolling out boosters. We do have a program of rolling out COVID boosters within our prison and jail population.
Maybe this is also a good time, as we're talking about vulnerable populations, to touch on one of your other areas of expertise, which is mental health. So, I know that during your career and during your tenure as Surgeon General, you focused quite a bit of your time and energy on combating the effects of adverse child experiences, or ACEs. Can you speak briefly to this and how you feel that the effects of the COVID-19 pandemic and associated public health measures will affect the long-term mental health of our children?
Absolutely. So one thing that I want to clarify that I think is really important is that when we talk about the impacts of adverse childhood experiences, one of the things that's it has a profound impact on our mental health, which I think is kind of more well known, and then also on our physical health, or what we traditionally call medical conditions. I think of it all as health, right? Like the body is, the body doesn't make that distinction. In March of 2020, when we were preparing to the governor was preparing to issue the remain at home orders. And I immediately kind of looked at, I just had like a flash forward. And from the research of what we know about the impact of stress and adversity on our physical and mental health, right? That it was predictable. We would see a predictable increase in many different types of stress-related health disorders, right? So including things like depression and anxiety. What we've seen globally, and I think it was JAMA that recently put out a paper that said that that documented that depression and anxiety among children and youth has doubled worldwide since the start of the pandemic. Like, I just want to pause on that. Has doubled worldwide since the start of the pandemic. The things that we flashed forward to and looked and said, oh my goodness, what we're likely to see: an increase in intimate partner violence, an increase in substance use and misuse, an increase in many different, like I said, stress-related health conditions. And one of the things that we did actually was the Department of Healthcare Services issued an advisory to all of our healthcare providers. I hope you all saw it, that said, you know what, adverse childhood experiences will be increasing as a result of this pandemic because of a combination of factors. One, there's increased stressors that will increase all the things that I just talked about, right? And then we recognize that ACEs in and of themselves are harmful to health because they can lead to the toxic stress response, right? The prolonged activation of the biological stress response that can affect the way a child's brain, hormonal system, immune system develops, and even the way our DNA is read and transcribed. And that toxic stress response is more likely to occur in absence of nurturing, buffering, safe and stable relationships that can actually prevent the development of this prolonged activation of the stress response. Well, we had a pandemic that's extremely stressful, that was not only psychologically stressful, but there was great economic hardship for many, many people. We did see increases in mental and behavioral health conditions, in substance dependence, and intimate partner violence. And our kids were, because of the necessary public health measures, were away from a lot of the resources in schools, the after school sports, the mentors, the coaches, all that whole network of safe and stable and nurturing buffers to prevent the development of the toxic stress response was also, gone because of the pandemic. And I think so what we anticipate now is that as kids are coming back to in-person learning, right? This is one of the things that we've worked very hard on with the California Department of Education, is a recognition that we have to be doing trauma-informed practices in our educational settings, because a lot of these kids are going to be coming back and they're going to be showing symptoms of a prolonged activation of the stress response. But we also, as clinicians, as healthcare providers, here in California, we launched the ACEs Aware initiative to train healthcare providers on how to screen for adverse childhood experiences, how to identify signs and symptoms of the toxic stress response, and how to respond with evidence-based interventions like mental health interventions, safe and stable and nurturing relationships, access to nature, all of these things that help to regulate our physiologic stress response. And so we're really, really pleased that even in the course of the pandemic, over 20,000 healthcare providers in California have taken that ACEs Aware training. And we see that there are many, many providers that are now screening for adverse childhood experiences. I think that's a really, really important thing for us to be doing coming out of the pandemic, right? Because so many kids are at risk for toxic stress. And one of the things that we know is that early evidence-based intervention improves outcomes. And so these are some of the things that we're trying to raise awareness. We just worked in partnership with an organization called the ACE Resource Center to launch a national public education campaign about ACEs and toxic stress and their impacts. It's called numberstory.org, and it's resources for regular people, not just healthcare providers, but for families, for parents, to understand how do they, recognize if they've experienced ACEs, if they're a parent who's experienced ACEs, right? How do they recognize that and respond? And, I think that the administration's commitment to addressing these issues has never been more apparent than with the governor's signing of the $4.4 billion investment in comprehensive mental and behavioral health for children and youth, right? That is like, again, a nation-leading investment in terms of really building a system, everything all the way from prevention. And that's one of the things I'm always shouting about when it comes to mental health, is the importance of prevention, as well as, all the way to our school-based services, all the way to increased resources and support for our primary care providers who are really on the front lines. How do we, and then all the way to, brick and mortar for inpatient beds. So, and the connection and the communication from start to finish. So that's an extraordinary thing that we'll be rolling out in Health and Human Services. I'm really honored to be part of the team that's working on this. And, we look forward to building this powerful infrastructure for our children and youth in California.
We thank you very much for all of your work in this area. It's so important to bring out the awareness on this topic, especially during this time when the pandemic has just really made everything, multiplied everything. Does the state of California have any plans to address burnout amongst physicians and other healthcare workers that has also become greatly exacerbated during this pandemic?
Yeah, oh my goodness. So that is something that we know is a huge issue. I think I will say that one of the things I recently did pull together a talk where I was recognizing that, number one, that this pandemic has been put an extraordinary burden on not only our healthcare system, but on our healthcare providers. And that is something that as we have rolled out the ACEs Aware initiative, as we're doing a lot of this training for our healthcare providers, one of the key aspects that we recognize is that we have to promote and support systems that allow for our healthcare providers to practice self-care, right? And not just on the individual level, but we have to promote systems in a systematic way. And so that's something that we have built into our ACEs Aware initiative. And it's also something that we are inserting into our comprehensive children and youth mental and behavioral health initiative, is really look at how do we give our providers the support that they need, because people are exhausted. People have been working under extraordinary conditions, and they're worn out. And so one of the things that we've done, working with partners, the California Medical Association and Physicians for a Healthy California, actually launched an initiative called Care for Caregivers Now. That was launched in March of 2020. Perfect timing to help our providers deal with the unprecedented emotional burdens that came as a result of the COVID-19 pandemic. And they also provide free and confidential peer coaching from trained medical practitioners who really understand the rigors of the emotional stresses in the profession. So that coaching has been available for MDs and DOs, right? So physicians, physician assistants, nurse practitioners, RNs, respiratory therapists, medical students, residents, public health officers, and then also folks in our medical reserve corps. And it's really about, just trying to provide some of that relief from the emotional exhaustion and the burnout that you highlighted. There's also some federal legislation right now that's pending, that's addressing physician burnout. And so you may be familiar with the Dr. Lorna Breen Healthcare Provider Protection Act, and that's currently working its way through.
Thank you so much. It sounds like an enormous amount of work. And I think certainly all of us are looking forward to a return to normal life. So a few items there. Does the state have any planned vaccine verification systems to ensure safety, especially at larger indoor gatherings, rather than relying on our little physical, cards that we all got, the little CDC paper copies?
Yeah, that's something that we've actually been working on. So getting that digital COVID-19 vaccine record has been getting that up and running has been quite a bit of work. So the California Department of Public Health just posted a public health order that now requires providers who are giving the vaccine to request the patient's email or their cell phone number so that they can automatically connect it to that digital vaccine record, instead of having to get folks to go in and try to input their information. And there were challenges with if the name or the date of birth wasn't exactly matching, then there were challenges with having it go through with a digital vaccine record. We are working on correcting that and addressing that so that it's much more seamless. The information is collected upfront, so it automatically populates into the vaccine record. And that'll allow people to get access to that digital vaccine record more quickly, easily, and seamlessly.
Great.
Also talking about trying to get back to a normal life. We have several questions from the audience about kids going back to school. Questions about, should they go back to school without vaccines being approved for children? How can schools get some of the funds to help with COVID testing, contact tracing? And also, how can we effectively advocate for more resources for the education and mental health of kids in school?
Yeah, so the administration put out a safe return to schools plan, really focusing on how can we ensure that our kids can return to in-person learning as safely as possible. So we know, especially as pediatricians, we recognize that what kids receive in school is more than just the 3 R's, right? It's some of that in-person connection, that social emotional learning. It's having a safe and stable adult to lay eyes on them every day. They get meals, they get all. So we recognize that there are substantial benefits for kids returning to in-person learning, but we have to make sure that our kids can do that safely. And that's why we've invested more than $25 billion in making sure that our kids can go back to school safely. So that's everything from updating the ventilation system. So, a pile of money so that schools can update their ventilation systems, cleaning and disinfecting enhancements, personal protective equipment, COVID-19 testing and contact tracing, right? Additional teachers and staff and supports to enable a lot of these, to deal with some of the added challenges of trying to teach in a pandemic. And so all of these things are things that we have invested in. As I mentioned, we do have the Safe Schools Reopening Plan that I think probably someone from my team can put in the chat to share with folks. But as a mom of 4 boys myself, kids who are back to school and doing that whole thing. My 9-year-old was actually home this week because he had a cold and he can't go to school with symptoms, but he's COVID negative, so that was good. But it was a fantastic example because we were able to look up testing, right? He started having symptoms in the evening. We were able to look up testing, get him a COVID test. He was able to get a test at 8:30 a.m. the next morning. And then, we just got the results back, and fortunately he's COVID negative. But those type of resources so that parents have quick access to make sure that they have, that we have the resources that we need, that we're clarifying our policies, and that we're able to keep our kids safely in-person learning, I think is incredibly important.
I'll ask you one also from the chat that's, I think, a little bit tougher, and see what you think about the possibility of vaccine mandates for school.
Ooh, that's a great question. So I think, what do I think about the possibility for vaccine mandates? I will say that folks have asked me about this before, and what I will say is that it's part of our public health arsenal, right? That when a vaccine is approved for use, that we use vaccine requirements, you can call them mandates, to my 4-year-old just came through to visit me. But that has been a routine part of our public health practice for a really long time. So what I will say is, it's not off the table. You know, we've been having that conversation with the governor. We're evaluating and assessing that tool for California. And I think it's an important public health measure to keep our communities safe. So it's something that we're investigating. We are going to look at every tool in the toolbox when it comes to our public health tools to keep the public safe in California. And ultimately we'll decide, you know, which ones feel like they are the right ones for California, but we definitely want to look at everything.
Fair enough.
Can you tell us a little bit about how you are living your life now? It sounds like your kids are back in school. Do you wear masks indoors? Do you eat at restaurants? What is your life like now?
That's a great question. I'll tell you what my life is like. I just had a naked 5-year-old run through my office, that is how it is. I will say, so I do eat at restaurants, but outdoors, right? So it's really about, it actually feels important to me to support our economy, to support our small businesses. And so I do eat at restaurants, either takeout or eating outdoors. I do wear masks indoors. Absolutely, you betcha. And one of the things that was really funny, I was just down in Orange County for an event where I was speaking, and in my hotel, right? Like I'm going to get something, get a glass of wine at the end of the day, and nobody's wearing a mask. Not a single person. And, you know, we have mirror neurons. And so you almost feel like, oh, shoot, am I supposed to wear? And I was like, wait a minute, of course I'm going to keep my mask on. But it was, it's just really, I'm accustomed to being in environments where everyone is wearing a mask, but it really was a moment for me last weekend being down in OC and just being like, oh no, I guess this is the moment where I'm the crazy person, like the only person in the entire place wearing the mask, but I'm surely not going to expose myself to the Delta variant. So I'm fine. But yeah, that's, just, I think like everybody else, I will say, asking how we're managing and how I'm managing and all that kind of stuff. I think like many of you, I'm tired. I'm tired of this pandemic. I would really love to get back to normal. I think that, the great example, I talked about my 9-year-old had a cold. And it was, probably a cold, but when we did the COVID test, there was a moment where it's like, oh my gosh, what if it's not a cold? What if it's COVID, right? And that moment of fear that comes up. And, my 5-year-old also, our 18-year-olds are vaccinated, but, my 9 and 5-year-old are here and they're unvaccinated. And it's like, as a mom, there's still that moment of fear. And I have to say, and I hope this is something that you all can relate to, I really, really have had to step up my self-care game because the work is hard, it's stressful, it's long hours, and we are cut off from some of our usual self-care routines. And so for me, connecting with my girlfriends and like talking it out and sometimes crying it out. And one thing I did that I instituted with some girlfriends of mine during the pandemic was something called walk and talk, right? Which we're outside, we go for a walk and we just talk about all of our problems. And it just, it's like my favorite part of the week is meeting my girlfriend at the park in the Presidio, and we do a walk and talk 5:30 in the morning, right? So that we can connect and have that conversation outdoors. But yeah, that's something that I would say for everyone, like, don't underestimate what we're going through. If it feels hard, it's 'cause it's hard. It's a once in 100 years pandemic, and we have been on the front lines, and it's exhausting. It's sometimes demoralizing. It's frustrating. It's isolating. It's all of those things. And so we have to give it the credit that it's due. Like I tell people, don't try to do this, like sometimes we look at our productivity and we're like, oh, it feels like I can't get as much done as I hope to get done. That's okay. That's okay. We have to give ourselves some grace right now. For me, I do my meditation practice and my workout, and I talk to my therapist on a regular basis. All of those kind of self-care practices, I think are more important than ever. And I just want to encourage folks to embrace that.
Wow, I think that's really helpful advice to everybody as we wrap up our hour here, to remember self-care, to support each other as we go through this. Really, really important. And I also want to just apologize for my county, by the way, and promise you that there are plenty of those of us here at CHOC are the other crazy people who are all masked indoors. You're not the only one. So I do want to thank you so much from all of us at the California Immunization Coalition and the AAP for taking time out of your evening and letting us pick your brain on this whole host of topics. We really appreciate it, and all of your hard work that you've done for our state, our communities, and our children.
Well, it's my pleasure and honor. I'm so grateful to all of you for the work that you are doing. And if there is one thing that I can say, is that we see you. We see you. Thank you for your work.
Thank you so much for joining us today and giving us your expertise. Just a few, one slide just to say that there is an evaluation right after this, and it's so that you can tell us what other topics you would like to hear about, and if you have any recommended speakers also. So again, thank you so much on behalf of the California Immunization Coalition and the American Academy of Pediatrics. Right.
Have a
Good night, everybody.